that the most common reason why people put in claims to VPI, which is one of the insurance agencies, is firstly because of skin allergies. And you'll notice on the slide it also has ear and skin infections there as number 2 and number 4. I can tell you that almost all ear infections and almost all skin infections are associated with dogs with skin allergies. So by far the most common thing for dogs is skin allergies and their infections. And I know you're probably very frustrated, but you're not alone. According to data that we have at Zoetis, over 2 million dogs in the U.S. have allergic skin disease. So it's a really common problem. So how do we recognize itch? And this is really important because as a veterinarian, when I examine dogs, I don't necessarily see them demonstrating the behavior that's so characteristic and that's abnormal and tells me that they have itch. It's really up to the owner to tell me that they see their dog having any one of these 5 or 6 different behaviors, which are a reflection of itching in dogs. So dogs may bite, as this dog is, chewing on the bottom of its foot. Others may actually have scratching, and this dog scratches at its side and scratching at its right elbow there. This dog is another one that has chronic itch, and it's gnawing or chewing at that groin, medial thigh, ventral abdomen area, and you see all the skin changes because of the chronic skin irritation. So any one or combination of these things tell me a dog's itching. As a clinician, as I said, I don't necessarily see that when I'm in practice and I'm in a consulting room examining a patient. What I see is areas of hair loss and redness, as we see in this dog on the top here, that has chronic facial irritation that's led to a lot of hair loss. And we see that the skin is red. And on the bottom, we see a Dalmatian that's licking at its feet and its toes chronically, leading to some hair loss and redness. In addition to that, we might see scratch marks, which we call excoriations. These are just these linear lines where a dog's claw has digging at itself on its side and left these self-induced marks on the dog. And for many dogs, once the disease has become chronic and there's been consistent self-trauma, what we see are these areas of thickened and really deeply pigmented skin, and they may actually be greasy and seborrheic as well. So these are all the signs that I see as a clinician. And unfortunately for me, regardless of the cause, whether it's one of a number of allergies or a parasite, the skin tends to look the same. It's just a consequence of chronic self-trauma. So there's not too much about hair loss or redness or the scratch marks or the thickening that tells me the specific cause of the disease. And of course, if you've ever been and lived with a dog that has chronic itch substantial period of time through the year or possibly year-round, you know that this really has a significant effect on their quality of life.